Hi, everybody. This is Diane Yantel. Thanks for joining today's call on coronavirus and housing and homelessness. As per usual for these calls, we have well over 2,000 people who have registered, and the line is just opened and I can see people rapidly joining, but I'm going to give it another minute or two before we get started to give some more people time to get on. Okay, hello everybody, good afternoon. Welcome to our weekly call on coronavirus and housing and homelessness. This is Diane Yantel. I'm President and CEO of the National Low Income Housing Coalition, and I want to welcome you all and thank you all for taking time out of an incredibly busy and important moment to hear from federal, state, local policymakers and people working in the field about what's happening related to housing and homelessness and coronavirus, to hear the latest challenges and obstacles, and to talk together about what we can do to make sure that the federal government is providing the level of resources needed to respond. So at the National Low Income Housing Coalition, our work is all about advancing federal policy solutions to ensure that the lowest income people have decent, accessible, and affordable homes. And we formed the Disaster Housing Recovery Coalition several years ago. It's now over 850 organizations that together we work towards just and equitable recoveries from our country's hurricanes, wildfires, and other disasters. And together we host these weekly calls to hear from people throughout the country about what's happening and how we can work together on the response. And certainly this disaster is unlike any other we've ever had in our country, just by magnitude and duration alone. Today we have over 50 states that have a major disaster declaration, which is the first time in our country's history we've ever had that. But the coronavirus as a disaster is also similar to other disasters in that we know that the lowest income people, the most marginalized people, people of color, people who are homeless, immigrants, people with disabilities, and others are going to be most likely to be harmed by the disaster and most likely to be left behind in the recovery unless there's dedicated advocacy and focus on their needs. So today's call, we have over 2,000 people. We have that have registered. We have a wide range of participants, people who are homeless, low-income renters, federal, state, and local policymakers. We have housing providers, homeless service providers, organizers, advocates, media, and foundations that have joined. So thank you all for joining. We have a lot of questions already queued up. I think we have over 100 questions that have been submitted so far. Thank you for submitting them. Keep submitting them. Use the Q&A box on your webinar screen to submit your questions, and we'll do our best to get them answered throughout the call by our speakers, by myself, or we'll follow up with information to get those questions answered. And I just want to point out that I think this is the fourth call that we've had, the fourth weekly call. We record each of the calls, we post them on our website, and so a lot of the questions that are coming in are questions on topics that we've talked about in previous calls, and just given how enormous a disaster this is, we can't cover the same topics each call. So I encourage you to go to our website, go to the COVID-19 page, and listen to some of those previous calls. We've talked about in depth around the eviction moratoriums. We've talked about the federal resources, ESG and CDBG funds. We've talked about unemployment insurance and checks and how to get those checks to people who are homeless. We've talked about FEMA and its role. So some people are asking questions about that. We're not going to talk about those on today's calls, but please go back and listen to previous calls so you can get many of those questions answered. We're also working on putting together FAQs that we'll be distributing soon, and can share to get some of those questions answered as well. So I'm going to start our call. I want to turn and see if Senator Brown is on the line. Senator, have you joined us?
I have, yes. I was, yes,
wonderful.
I have.
So let me just let everybody know that we're so pleased to have on the line Senator Sherrod Brown. He's from Ohio and a lifelong champion of affordable housing and work towards ending homelessness. He's the ranking member on the Senate Banking Committee. He's been very active in introducing or co-sponsoring bills related to housing and coronavirus. And it really was Senator Brown's leadership and his tremendous efforts and those of his staff that were instrumental in getting the housing and homelessness funds and policies that were included in the CARE Act. So Senator Brown, we're so grateful for your work and your leadership, and we're so glad to have you on this call. I'll turn it over to you.
Sure, thank you, Diana. It's an honor to be part of this. And Diana and I were most recently at a briefing with Matthew Desmond at the Capitol Visitor Center, and thanks for the work that you all do. And our gains were significant in the last bill, but we need to do much more in the next coronavirus. I guess coronavirus package number 4, I guess they will call it. But let me talk about some things generally, and then more specifically that. Congressman Garcia, I understand, is going to be in the call right after me. So welcome to him and his work. My friend Bill Faith will be speaking later in the call. And Bill Faith is one of my heroes. He has done incredible work in Ohio. I congratulate him on receiving the NOIHC's Lifetime Service Award. It would have been accepted at your conference last month, but it was obviously postponed. But he has made such a difference for so many families in Ohio, and he and his wife are a team, and I really appreciate the work they do. As Diane said, I'm the ranking member of the Banking Committee, except it's called Banking, Housing, and Urban Affairs. People too often just refer to it as the Banking Committee, and too often the committee acts like it's only the Banking Committee, forgetting about housing, forgetting about urban affairs. And and this is not a political call or a campaign speech in any way, but if the Democrats win the Senate, I will be chair of the committee, and the word housing will be in capital letters in the title of this committee. And I will come to all of you on this call. Many of you on this call, obviously I don't know all of you on this call, but I will come to many of the leaders on this call, people like Diane and Bill Faith and others, to ask for your input in helping us figure out ways to provide more housing, accessible, clean, affordable housing. I live in, as some of you have heard me say, my wife and I live in Cleveland. We are fortunate enough to be able to work at home and to continue to be paid. Millions of Americans, as we know, and to be safe, millions of Americans go to work every day now, and they're ambulance drivers, they're custodians, they're nurses and doctors at the hospitals, they're house cleaning at the hospital, they're working as city bus drivers, doing all delivery people, and we have argued and are going to push in this package that those workers, grocery stores, clerks, whatever, meeting people in the public all the time, exposing themselves, that they should, to this virus, that they should get some kind of pandemic pay for their efforts, as the rest of us so often get, are not out and about exposing ourselves to this. So, but my wife and I live in Cleveland, and we live in zip code 44105. Our zip code a decade ago had more foreclosures than any zip code in the United States. And you know what that does to a neighborhood, and you know what that does to people's quality of life. And you know what that means for some of the families on this call, and all of you who advocate for the families on this call. You also know that before the coronavirus hit, we already had a housing crisis in this country. This has just made it worse. You know statistics like a quarter of all renters before the coronavirus were paying at least half their income in rent. 25% of them, or 40% of Americans don't have $400 in their pockets to meet a car that breaks down, or to meet a family emergency, or a child's illness or something. That that in meaning they're living much too much on the edge, way more than most policymakers in Washington understand. We see the housing struggles interact with this crisis where people need to be able to shelter in place. So many people can't do the 6 feet apart in crowded living. Certainly in homeless shelters, as much as so many of you are working on fixing that, but so many people in housing where they simply can't be as safe as some of the rest of us are lucky enough to be. We see this now with workers who are laid off trying to figure out how to make their rent or pay the mortgage. We see it with the fear among homeless service providers. We know what it means for domestic violence. I did a conference call with a dozen presidents of Ohio's YWCAs, and almost all of them run domestic violence shelters and run food programs and housing programs. And the pressures of all that mean that Washington's got to pay a lot more attention in this next package. The package we passed last month, as Diane suggests, the CARES Act was an important first step. It put a moratorium on evictions and foreclosures for renters and homeowners in properties with federally backed loans, as well as renters receiving federal assistance. So many people who are living in a home they're buying, they have a mortgage, or people who are renting, many of them are protected, but not enough. And that's for the next package. We provided $12 billion in new funds to help homelessness organizations and housing providers and communities responding to the immediate demands of the crisis. But what I'm arguing for, and Chairwoman Waters in the House, the chairwoman of the Housing Committee there, Senator Jack Reed, the most senior member of my committee, we're asking for $100 billion in emergency rental assistance for renters, and the money going directly to renters to pay their rent. So even if they get their rent delayed, they would still owe 3-4 months from now, they'd owe 3 or 4 months worth of rent. So that's why we've got to get this emergency assistance so people can actually pay their rent to stay in their apartments now, and an additional $75 billion to help homeowners pay their mortgages. We need to make sure that homeless and housing service providers also have what they need to provide safe housing for people in their care. This weekend, we marked the 52nd anniversary of the Fair Housing Act. You may know that a week after Dr. King was killed, the Senate and the House finally passed the Fair Housing Law. All the Senate had done in the House with President Johnson 2 or 3 years earlier, civil rights, voting rights, Medicare, Medicaid, Pell Grants, Equal Opportunities Act, Higher Education Act, all those things Congress could do. It couldn't do the Fair Housing Law. It just couldn't get it through Congress until 2 years later, 2 and 3 years later, right after Dr. King was assassinated. It's clear that we need a housing system that works for everyone. We know what Jim Crow did. We know what redlining did, and some sense still does. We know the discrimination in housing policy far too often in housing actions locally. And we know that the federal government now in this administration is backing off enforcing anti-discrimination rules and then weakening those rules. So that's why we fight back. Your advocacy on the CARES Act was really important. Today's the start of the conversation. I want to hear from you as much as you can let my staff and me know what else we need to do. As I said, our priority for the next act is this $175 billion to keep people in their homes and apartments. We want to do more. We want to do more than that in other things, and please let us know. So thanks so much for letting me on the call, and I really, really appreciate the work you do for so many families in this country. Thank you.
Thank you so much, Senator Brown. Really appreciate your leadership. We're thrilled to hear you talking about the need for a uniform eviction moratorium, about $100 billion in rental assistance, more money for emergency solutions, grants. As you and your staff know, those are the top priorities for us and for thousands of organizations that are on this call. So we are behind you on that. We're thrilled to have you championing those really important issues. And thanks again for your time.
Thanks so much, Diane. Thank you.
Thank you. Okay, now I'm going to turn to our next speaker, who is Congressman Chuy Garcia. And Congressman Garcia represents the 4th Congressional District of Illinois. He serves as a member of the House Financial Services Committee, and he's also a member of the Congressional Hispanic Caucus, the Congressional Progressive Caucus, the Congressional Equality Caucus, and the New Americans Caucus. He is a strong champion for affordable housing, and he's introduced legislation to establish a moratorium on evictions during the pandemic. And he's leading a letter with his colleagues in the House to support $100 billion in emergency rental assistance to help keep low-income renters stably housed during the crisis. So, Congressman Garcia, we appreciate your leadership, and thanks so much for joining the call. I'll turn it over to you.
Thank you. Good afternoon to everyone on the call. I'm Congressman Jesús Chuy Garcia, and I represent the 4th District. I'm honored to follow Senator Brown, a fierce advocate for affordable housing in the Senate, and hopefully the next chairman of that committee. I serve on the Financial Services Committee, where Maxine Waters, a fierce advocate of all kinds of affordable housing, especially for working families and low-income people, is chair. I'd like to thank the National Low-Income Housing Coalition for your work and for bringing this conversation together. Thank you for fighting to make sure that everyone has a home in this troubling time. I represent parts of the Northwest and the Southwest side of Chicago, as well as a piece of suburban Cook County. My district is very working class, with a large immigrant population that has been hit particularly hard by business closures, layoffs. Many people in my district work in the hotel and restaurant sectors, and reduced hours is what they have gotten if they're still lucky to have a job. There are a lot of renters in my community. 52% of households in my district are renters. Here in Illinois, the governor issued a shelter-in-place executive order, and there's a moratorium on evictions until the order is lifted. Cook County is pausing evictions until May 18th, and at the federal level, the CARES Act included some protections against eviction and mortgage forbearance for homeowners. 3 weeks ago, I introduced the Rental Eviction Moratorium Act to make sure that no tenants are evicted during the COVID-19 public health emergency. Keeping everyone in their homes at this time has been a major priority. But what are my constituents supposed to do when the eviction moratoriums are lifted and they don't have any money coming in? Some people will face months of piled up back rent. It is important to delay eviction, but we need to keep people in their homes for the long term. That's why I sent a letter to House and Senate leadership last week, signed by 50 of my colleagues, urging them to include the $100 billion Emergency Rental Assistance Fund in the next relief bill. Senator Brown made reference to it. No one should face homelessness because of this virus, but if Congress doesn't act, many more people could be kicked out onto the streets. Landlords in my district are already handing out eviction letters, even though they won't be able to evict anyone for weeks, but they want to get their rent, but there is no money to pay them. Tenants are scared, but right now, the last thing they should have to worry about is the roof over their heads. No one should worry about losing their home when all this is over just because they couldn't make a rent payment. Congress must act, and I'm proud to work with my colleagues and to make sure that emergency rental assistance is part of the next relief package. Thank you for inviting me on the call, Diane, and everyone in the coalition.
Well, thank you again, Congressman Garcia. Again, we really appreciate your leadership and your championing of these incredibly important issues. And we really appreciate you prioritizing, as you have, the need for $100 billion in rental assistance. That's one of our top priorities. We strongly support you in that ask, and we will be advocating, as we have under the CARES Act, we'll be advocating next time to really push other members of Congress to join you in your effort to get that funded. So thank you again for your work, and thanks so much for joining us today.
Thank you, and sí se puede.
Sí se puede. we're going to turn now to, we moved our agenda around just a little bit, and we are going to move next to field updates. And first we're going to hear from Kathy Alderman from the Colorado Coalition for the Homeless. And I'll say that every week when we do these field updates, for each week, we are doing our best to hear from as many people across the country as we can. So each week we hear from different states, different regions about what are the main challenges that you're seeing on the ground, what are some of the biggest obstacles in your way, and what do you most need from the federal government to be able to meet the needs of people who are homeless or extremely low-income renters during coronavirus. So Kathy, I'll turn it over to you. Kathy's the Vice President of Communications and Public Policy at the Colorado Coalition for the Homeless. Thanks, Kathy.
Thank you, Diane. As Diane said, my name is Kathy Alderman. I'm with the Colorado Coalition for the Homeless and a new board member to the National Low-Income Housing Coalition, which I'm so proud to be joining because of the strong and strategic advocacy work that the organization does on behalf of all people experiencing housing instability and homelessness. So we've got a couple of efforts going on in Colorado right now. Primarily, we're working in the Denver metro area, which is where we have the largest number of cases in the state and the largest population of people experiencing homelessness. And we are doing a two-track strategy right now. The first is that we are desperately working to de-densify our current shelter systems, which are overcrowded and not able to implement physical distancing for their guests. And so we just recently opened an overflow auxiliary expanded shelter in the Denver area for up to 700 men. And this week it'll be taking in an additional 250 women. Unfortunately, this is not the most ideal scenario because we know that people need to be able to isolate and get as much space as possible. But we also know that the spread of this virus could be highly detrimental if it began in our shelter system. And so our part of that new shelter system is that we set up a new clinic space where we are screening everybody coming into the shelter, and anybody who has symptoms or fever gets triaged and then evaluated for whether or not they need to be tested. So far, we have screened 625 individuals and we have tested over 60. About half of those have come back positive. So we know now that we are keeping people out of this shelter space who are positive for the virus. And what we're doing with those individuals is we are entering into contracts with motels and hotels across the city. We brought on 100 rooms early on for this purpose. We just opened up another 100 over the weekend. This week we'll be bringing on an additional 174 with the option for another 138. And that's just the efforts of the Colorado Coalition for the Homeless. The city of Denver is also looking to contract with motels and hotels across the city. And this is for people in three categories. One, for people who are awaiting test results and need self-isolation and can't obtain that because they don't have a home. Two, for people that have received a positive test result and need to quarantine and stay in a safe place to recover. And then three, we're starting to open up spaces for highly vulnerable people who would be at risk for complications if they were to contract the virus. And so we're opening up those spaces and trying to move people in as quickly as possible and providing the full range of supportive services in those motels as we can. We know that FEMA will not support or provide reimbursement for the de-densification efforts. And so we're really looking to our state and local government to help us with those rooms while we work on this motel hotel strategy, which is a little bit slower to come online. We've pushed our governor pretty hard on providing those additional resources. We had 24 elected officials send a letter to the governor just recently to support this effort in Denver. We've signed on 2 more letters to increase testing capacity, personal protective equipment for staff and guests. And we're currently working on a letter to respond to all of the statewide needs because as the balance of state continuum of care, we're hearing from our rural communities that these motel hotel agreements are very difficult to come by. Sometimes they're not even available, and that these areas need some help as their shelters are starting to overcrowd as well. So we're hoping to get some positive response from our governor soon. We've also been working really hard with our federal delegation to make sure that they're aware of the issues, the funding needs, the testing needs, the equipment needs. And we just got notice actually that Congressman Jesús from Congressional District 2 here in Colorado last week, at the end of last week, introduced the CARE Act for those without homes. And this would provide an appropriation of $11.5 billion for the Emergency Solutions Grant Program. And hopefully we'll be hearing more about that as well. The second thing that we're asking for from the congressional delegation is to suspend the NOFA process to ensure that at least for the next year, people that are currently housed with HUD dollars aren't at risk of losing those dollars because the funds have to be applied for through this very competitive and arduous process. And so we're hoping that we can get Congress to suspend that process, at least for just renewals. And if people want to propose new housing programs through the Continuum of Care funds, those could go through the notice of application process, but not the renewal funding. So those are the things that we're working on. I will have to jump off the call in a few minutes, but I am more than happy to provide my email address. And if anybody has questions or would like to discuss how their efforts can mirror some of ours or might be improved from ours, I'd be more than happy to have those conversations after this webinar. And I thank you all for having me and for caring about this issue and advocating as hard as you are.
Great, thanks so much, Kathy. Thanks for all your great work and for joining the call. For those of you who've joined the webinar online, you'll see that Kathy's contact information is on your screen now. And for others, we'll be sending contact information for our speakers as follow-up information to everybody who's registered for this call. So thanks again, Kathy. I'm going to turn it now to Bill Faith from Coalition on Homelessness and Housing in Ohio, one of our longest and most effective partners and champions for affordable housing, as you heard Senator Brown say. So Bill, I'll turn it over to you.
Thanks, Diane. It was quite a compliment to hear from my senator, who is my hero. I will say that when we started looking at this issue, we kind of took a step back because we wanted to survey groups around the state. We wanted to do interviews with people around the state that were on the front lines. And we were fortunate to have help to publish a report called Double Jeopardy, which is about homelessness in the pandemic, which really brought to light the intersection between people who are enduring homelessness and are now facing the double public health crisis of homelessness and the virus. So it really brought to light, again, the deplorable and unsafe conditions that we are forcing people to live in these shelters. And that we've all gotten all too complacent and used to this is an acceptable part of our society. So in Ohio, we have 300 large shelters in both urban and smaller communities around the state. There are about 10,000 people a night that are in these shelters, probably with 2,400 staff that staff these facilities. And what we found is these groups have very limited ability to shelter in place safely. They have virtually no ability to social distance the way things are now. They have no supplies, no PPE. They lost volunteers, they lost staff. So we got busy to address these issues, and we established a pandemic fund that is set up through Ohio, which we've raised about $1 million for and distributed most of that as of this morning out to groups with mini grants to help them address some of the issues that they're dealing with. We've done incentives for staff to stay on the job. Many of these workers don't get paid squat. I mean, it's 12, 14 bucks an hour, and they're risking their life. So we've encouraged bonus pay. We've done things to help deconcentrate the shelters. We've done a lot around supplies. Just sent out 30,000 masks to groups on the front lines around the state. We're planning to send more before the end of the week. So some of our efforts are similar to what the woman from Colorado talked about, setting up hotels and motels for vulnerable subpopulations. I've kind of lost track. We're probably over 1,000 of those hotel rooms that have been secured. We've set up isolation and quarantine programs in a number of existing facilities and in some new facilities, and also have helped with deconcentration of shelters so that people have more opportunity to spread out. We had a very good, I don't know if you all have paid attention, but our governor and our state director of health have been very good in their efforts to address the pandemic in Ohio. We have an executive order from our health director, which really opens the doors to get FEMA money flowing into our state for all of these kind of deconcentration, lower density issues. And we are arguing with them currently about opening that up fully to vulnerable populations so that we can get them out of harm's way. That includes those that would have difficulty maintaining social distance within the shelters. So that could be families with children, but certainly older folks, people with pre-existing conditions. Right now, we're putting in a request for $30 million of emergency funds to our governor that would help us get through the next 6 to 8 weeks until we get the federal money flowing. I've checked with all of our programs, and CDBG and ESG will really won't arrive in the field for another 6 to 8 weeks. So we're trying to make sure we get through that period as best we can. So the governor, to give you an idea, they've set up multiple strike forces, they call them, there's one on housing and homelessness, one on philanthropy, one on addressing hotspots, and there's several others. They've asked us to serve on many of these, so we're getting good cooperation from our governor and his administration. I will say too that they just gave us $1 million for our pandemic fund, which we'll try to figure out how to use well. So that's kind of an unusual situation. We also have been working hard to find other money. So we got $5 million from our housing finance agency. We've had success of getting some of our agencies to reprogram existing dollars to apply toward the pandemic. We got a little bit of money from CDBG and things of that nature. We're also into an advocacy campaign to get TANF money released from our state. We have surplus TANF funds that could be used to help families get out of the shelters, back into their own housing, and could also help with doubled up and tripled up folks to get them out of crowded conditions in people's homes. We are also working with the philanthropic community quite a bit on getting monies set up in local communities for these issues, as well as supporting our pandemic fund. So as other people have said, our big issues right now are we need a big ass rental assistance program, like something like we've never seen. And because as much as we're making progress on these fronts, we have, in our state, we had, 600,000 or more people apply for unemployment just in the last couple weeks. That problem, it has to be addressed with something on scale that could really help those people hang on to their housing and avoid having to hit the homeless system. And as much as we did receive for ESG, it'll not be enough. I mean, we have big needs in this area. We estimated our cost for the first 6 months of the epidemic at $108 million. That's to help people that are unsheltered and those currently in shelter, and divert people and get people out of the shelters as quickly as possible. $108 million just in the first 6 months. So we got a long way to go to get the money assembled to address this issue.
Thanks, Faith. Thanks, Bill. You're doing amazing work. I really appreciate your leadership in Ohio, and I appreciate you coining the new name for our rental assistance expansion. So thanks for that, Bill, and thanks for joining during such a busy time. I appreciate it. So I'm going to turn now to Hank Hughes with New Mexico Coalition to End Homelessness to hear about what's happening in the state of New Mexico. Hank, please go ahead.
Oh, thank you, Diane. Took me a minute to find my unmute button, but I think I'm here. So New Mexico is one of the poorest states in the country. It's also very rural. It's also, and I think this is not unusual, we were not at all prepared for this in our homeless response system. So a number of things have happened that we weren't prepared for. I think just to point out, we have been lucky. The virus has not hit New Mexico very hard yet. Only 2 homeless people in New Mexico have tested positive, and we have one of the highest testing rates in the country. So we are testing a lot of people. So we've had a little more time to prepare, which we probably needed because, like I said, we weren't prepared. We've been having weekly calls with our state government to figure out the testing issue and try and figure out where we can put homeless people. Like I said, some things happened that we maybe didn't expect, but we should have. The first reaction of our shelters simply closed, and so they're not taking people at all. And
Hank, I think we're losing you. I think we've lost you, Hank. Are you still there? Okay, Hank, I think you may have dropped off or muted yourself accidentally. Okay, we're gonna see if we can figure out what's happening with Hank's line. And in the meantime, we'll move on to another speaker and we'll come back to Hank later. We're gonna move on to Richard Chuy. But before we do, I just want to say again to please keep your questions coming through the Q&A box, and to we have several folks on the policy team and the field team who are working on answering your questions through the Q&A box. Other ones we're going to get to during the throughout the call. We've got a lot of questions coming in about FEMA, what FEMA resources can be used for what, and we have a whole topic planned on that later in this call, so we'll get to many of those questions. But keep your questions coming. We'll do our best to answer them via the Q&A box and also throughout the call. So, and Hank, it sounds like we lost Hank, so we'll try to get him back on. So now we're going to turn to Richard Chuy, who is the CEO of the Connecticut Coalition to End Homelessness. And Richard was on our first national call several weeks ago to talk about the challenges in Connecticut. And since that time, he has just done such incredible work with deconcentrating, decompressing the shelters, getting people off the streets and out of the shelters and into hotels. And so we invited him back to talk about what he's done and also what he's learned and tips that he could share with others across the country who are trying to do similar things. So Richard, thanks so much for joining, and I'll turn it over to you.
Great, thank you, Diane. And it's hard to believe it's only been a couple of weeks since the first call. Quite a bit has happened in our state in the last several weeks. In the last, I guess, 2.5 weeks or so, we went from an effort where we were initially moving out people who were 60 and above or who had underlying conditions out of shelters and into hotel rooms. Those were being done fairly ad hoc and on a case-by-case basis. But what we also realized was that as the pandemic was essentially creeping up into our state very rapidly, as most of you know now, New York City is really where the epicenter of the pandemic is in the United States, and Connecticut being literally just miles from New York City. And so we've been seeing our cases in our state rising overall, going from Fairfield County, which borders on New York City, and really moving upwards into the state fairly rapidly. We elevated to the state the need to do a much larger scale decompression of our homeless shelters across our state. And through our state's unified command pandemic response, we were able to help them understand the public health priority of immediately removing people out of congregate shelters where people are sleeping literally inches apart. And so over the last 2 weeks, our state created a state task force that was focused on decompressing our shelters, where roughly 1,000 to 1,100 people have been moved now into about 800 hotel rooms in 15 locations across our state. Our state agencies have directly contracted with those 15 different hotels, and they've entered into state contracts. They're using state dollars to actually cover the cost of lodging. They're also providing some additional support to the shelter providers who have relocated staff and operations within those hotels, and are also delivering meals every day to those hotels. And they've also, at the same time, were able to seek FEMA reimbursement for that, what they're calling the non-congregate sheltering effort. And FEMA has approved the state's request to provide reimbursement at 75% of those costs. And then in addition, there's an effort to engage with philanthropy to assist with additional costs that won't be reimbursed by FEMA or that won't be covered by state resources. So essentially, we have almost nearly completed that full relocation process. There's one final hotel under negotiation out of the 15. And at this point, we have relocated, as I mentioned, 1,000 to 1,100 people into those hotel rooms. I'll tell you, the hotel negotiations were challenging, despite the fact that hotel owners are struggling for business, but they still were lots of concerns about liability, lots of concerns about damages, about what happens at the end of this emergency, and will people be able to leave. A lot of that was worked through, and I have to say there's been generally great cooperation from hotel owners, but I have to really credit our state agencies for really handling those negotiations very well. We also, Connecticut's a unique state in that we don't have county governments. We are a state that's comprised of 169 separate municipalities with no county government in between. And so there's a sense of hyper-localism in Connecticut. We did have a little bit of pushback from at least one mayor, although many of the other mayors and town leaders that we have in our state were highly supportive of this effort. We did have one that was challenging. And so, we experienced a lot of the same kinds of stigma and NIMBYism and challenges that we face in general in the homeless population, but magnified to an nth degree with respect to this hotel shelter decompression effort into hotels. So lots of lessons learned in that process. We're still learning what it takes to actually relocate shelter operations within hotels, and lots of kind of challenges that are arising. We now have people who, with behavioral health challenges, who were used to living in a congregate setting where they had a sense of support from peers as well as from staff, who are now in rooms, generally being used on a double occupancy basis. But as you can imagine, now being put behind within a two-person room, there's a lot more challenges in the sense of isolation that can take place, and lots of mental health issues. So we're working to try to ensure that every hotel site has not only on-site staff, but also health and behavioral health supports. We're also making sure that every hotel site has a infectious disease protocol in place with their local health departments. So our state Department of Public Health, our Community Health Center Association, our Hospital Association are working through to ensure that there's protocols for how to access testing when people need hospitalization, what happens after hospital discharge, and to what degree people can isolate within those hotel rooms. I'll also just note quickly that we estimated our hoteling needs not just to decompress shelters, but also to build in space for anticipated inflow into shelters. So any people newly seeking shelter in the next 30 days, as well as some anticipated space for isolation in case we have people who are essentially persons under investigation of COVID, to be able to quarantine on a single occupancy basis and even isolate on a double occupancy basis. So our hoteling needs do encompass those needs. And then the last thing I'll just note is, now that the hoteling effort is largely completed and we're relocated shelter operations to the hotels, the real big focus over the next several weeks is going to be to really revive the focus on housing. Our shelter providers are coordinated entry system networks, and our housing providers have all been working to try to do as much housing as possible, albeit that's challenging now that many agencies are working virtually and from home. But we are going to ramp up our efforts. Our state has loosened some regulations with regard to use of rapid rehousing. We also have some private dollars that we're going to be bringing to bear to provide flexible financial assistance to help with security deposits and other move-in costs. But really, I think I heard Bill Faith say that we really need a lot more rental assistance and vouchers, and I would agree with that. So we're going to be making a big push in the next month or so to try to move as many people out of hotels into permanent housing, which will not only enable us to meet any new demand for shelter space within those hotels, but also, frankly, to just assist us with this exit strategy, as the hotels are really meant as a temporary option just to keep people safe. But really, we want to get the focus back on helping people to have a stable home, which is, frankly, the safest place they could be with this pandemic. So thanks, Diane.
Agree, Richard, and thanks so much for pointing that out and for thinking ahead to what happens. We're already getting a lot of questions for you about exactly what you just answered, which is what happens when the leases are over, when the stay-at-home orders are lifted, and how do we make sure that people aren't going back to shelters or sidewalks where they were sleeping before they got into the hotel room in the first place. So I think you already answered that, although if you want to say more, people are really interested. And also some questions about how long you're providing the hotel rooms for, and how did you negotiate the length of stay? Is it through May? Is it through June? And how are you basing that negotiation on?
Yeah, so our state extended the stay-at-home order through the end of April, although our governor just extended that somewhat further. So the initial hotel contracts were done through May 1st with a move-out date of May 1st, but with a clause that they would enable them to extend that further if the emergency was extended further. So the initial contracts that were all executed in the last week or so all have an end date of May 1st, with the idea that those likely will be extended. The state also provided initial payment. In most cases, hotel owners many of them asked for a full month of payment. The state refused to do that, but they did give them some advance payment. So I think most of the hotels have been paid 2 weeks in advance for those hotel rooms. And all of that is laid out in the governor's executive order that was issued, that was not only authorized this shelter decompression effort on a statewide basis, but also was a step needed to seek FEMA reimbursement.
Mm-hmm. Okay, thank you. And there's a question too, it's an interesting one about how Connecticut and many other states have been looking at hotels and motels as the first option, which is a good one, but whether there's been any thought to and any success with getting dorm rooms in colleges and universities that are closed.
Yeah, actually, that was the first thing that our state looked at, was the potential looking at college dorm rooms. There was the immediate logistical challenge of a lot of the college students left pretty quickly and their possessions were there. So that became not an immediate option. But then subsequently, I think the state's conversations with the colleges and universities has been to use those spaces for any potential overflow of people who are being discharged from hospitals. I've lost track of where that is, and so we shifted quickly from the dorms and decided to focus on hotels instead. And I can't tell you exactly what the thought was behind why dorms fell off the table and the hotel rooms, but the hotels ended up becoming a better option because many of them were struggling to get business anyway, with our state having a stay-at-home order in place.
Yeah. Okay. Thanks, Richard. And one last question that I'll ask you, that's kind of an overarching one, is that it seems that you all in the state of Connecticut were able to relatively quickly, especially compared to other states, get all the major players to be kind of rowing in the same direction quickly. How did you do that?
That's a great question. I would love to say that it was all like premeditated and pre-planned, but it didn't quite work that way. Our Department of Housing initially, as I mentioned, helped to secure some hotel rooms for the high risk over 60 and people with underlying conditions. That happened fairly on a kind of case-by-case basis with particular shelters. But we were getting a lot of pressure, frankly, from our membership at the coalition. So some of our local shelter providers were really feeling the pressure and the fear. There was a sense of, the pandemic numbers just rising, particularly in the lower parts of our state and moving upwards from fairly quickly, in the sense that shelter staff were panicking. Some staff were starting to be found tested positive. And so we felt like there was a major rush. It was then that we and the Department of Housing went to our state's unified command structure. So, I have to credit our state emergency response system has been really effective. They've developed an emergency response system that's responded to things like hurricanes and other things in the past. And through that infrastructure, we were able to elevate, make them understand that homeless shelter decompression was not just something that was about protecting some subpopulation within the state, but really recognizing that given what the CDC guidance has been, and given the fact that any congregate settings where lots of people live have the potential for causing outbreaks, not just among homeless people, but for the whole community at large, they recognize that the decompression of shelters was a public health priority for the whole state. And so that got lifted up to become one of the top things that our state was focused on. And that really mobilized our state agencies to assist with the securing of hotel contracts, assist with putting forward the costs, assist with seeking FEMA reimbursement. And then really we were able to coordinate through our regional coordinated access networks and the organizations that lead each homeless services region to work with their local shelters to determine which shelters needed to be prioritized for decompression, how many hotel rooms were needed, and that information was used by the state to help identify hotels. So, it was really, once the issue was understood by our state, it was really a matter of getting all the right agencies at the table and facilitating a process for having a coordinated shelter decompression effort.
Great. Well, it's really impressive work that you've done, Richard. I really appreciate your incredible effort and your leadership. And thanks so much for getting on the call to share these best practices. I know they'll be helpful, really helpful to others around the country who are working to do the same. So thanks so much.
Thanks for having me.
We're going to stick with the best practices and lessons learned, and I'm going to turn to Greg Payne from Maine Affordable Housing Coalition, and he's going to talk a little bit about rental assistance, how cities and states, how the state of Maine is looking at rental assistance programs, and also using some of the federal programs like CDBG dollars for that purpose and how they can all work together. So Greg, I'll turn it over to you.
Great, thanks Diane, and thank you to all the good work that you and the rest of the staff are doing right now. We really appreciate it. I'm going to focus particularly on the CDBG piece as we look at rental assistance. But, I think like other people who have been talking today, at least given the executive orders in our state with tenants at least temporarily protected from imminent eviction, we're really kind of turning to focus on ensuring that folks have access to rental assistance and we avoid the prospect of a mass wave of evictions in the future when courts start processing eviction cases again. So as we work with our partners within state to identify funding sources for a rental assistance program, as part of that, we're digging into the various options that are in the CARES Act. And, almost kind of by process of elimination, we find ourselves pretty focused on the CDBG dollars, because if the ESG money is needed to make sure that folks experiencing homelessness are safe, then at least within the HUD portion of the CARES Act, I'm not sure what else is realistic in terms of rental assistance program options. So given that, at least for now, we're sort of backing into looking at the CDBG program, even though it's a bit of an awkward fit in many ways. We're discovering some challenges that I'll just share because I think folks in other states are probably starting some of these conversations right now too. And obviously first, there's no stated priority in the CARES Act CDBG funds for rental assistance. So all the various and traditional uses for CDBG are still eligible. And even though there may be other viable CARES Act funding sources to meet some of those other funding priorities, sewers, hospitals, whatever, there is no other viable CARES Act funding we can find to meet this enormous rental assistance need. And so in any case, the it's going to be difficult, I think, wading through the various demands on that particular resource. Second, the first wave of CDBG dollars, this $2 billion in total, is being distributed per the typical annual allocation formula. So it's broken up between the various entitlement jurisdictions in each state and a non-entitlement balance of state share. And that creates an inherent challenge with developing a coordinated program because, at least in our state, there's now 7 different government entities who are getting these dollars and setting up 7 different conversations and processes about how to spend them. And we're going to reach out to all of them and ask them to coordinate with each other. But, it's hard to predict how much success we're going to have with that. Third, there is a standard rule in the CDBG program, which at least for now still applies with this first $2 billion in emergency CDBG dollars. And that requires that none of the statewide non-entitlement share be spent in the separate entitlement jurisdiction. So, for example, here in Maine, if city officials in Bangor decided to spend their share as an entitlement jurisdiction on some other use altogether, which certainly is their right, tenants in Bangor, it's not like tenants in Bangor could apply for rental assistance through any program that the state establishes with its non-entitlement share. They would just be out of luck. And fourth and finally, the funding allocations to the different entitlement jurisdictions aren't necessarily proportionate to where the renters live, and certainly don't account for the large difference in rents that generally exist between entitlement jurisdictions and the balance of state. So, for example, $100,000 in the balance of state pool with fair market rents around $800 for a 2-bedroom unit would help 125 households, but that same amount of money would only help about 77 households in Portland, where 2-bedroom fair market rents are more like $1,300. So I'll stop there, but suffice to say that at the same time, we're working to get past some of these challenges to be able to use emergency CDBG dollars to support this desperately needed rental assistance program. We're also learning pretty quickly that we're going to need to advocate for something very, very different in the next congressional relief package, something like the specific rental assistance funding that the National Low Income Housing Coalition is advocating for now, and which has been raised on this call several times already.
Yeah, thank you, Greg. That's really helpful to lay out both the need for us to be thinking about how to use the current funding from the CARES Act for this purpose, and also to be thinking ahead about how we fix some of the challenges that exist now. There were a couple of questions around, other funding sources, or they were more comments really, other funding sources that can be used for the same purpose, and including the emergency solutions grants and the much larger pot of money around the coronavirus relief fund, which certainly similar thinking and conversations I think are happening around how to use those dollars for the same purpose. And I just wanted to share too with all of the people on this call that at the National Low Income Housing Coalition, we've been working with National League of Cities and National Alliance to End Homelessness, mayors and CEOs for housing investments, to sort of pull together this kind of feedback and thoughts from Greg and others around the country from mayors, and to put out, hopefully this week, in the next couple of days, some guidance for states and localities to use the funds that are existing now for rental assistance while we keep working on getting this $100 billion fund out of Congress. So more to come on that. But Greg, thanks so much for your work on this, and thanks for joining the call today.
Thank you, Diane.
So I'm going to turn back and see if Hank is on the line. Hank Hughes from New Mexico Coalition to End Homelessness, and I want to give you a couple minutes to finish up your state report. Hank, are you there?
I'm here. Can you hear me?
Okay, great. I can.
Yeah, we're having a snowstorm here in Santa Fe, and perhaps that's why I lost my internet. I don't know.
Okay.
But I'll try and just talk about a couple things that I don't need to go over things that other cities have already talked about. But one of the things, Santa Fe, the capital of New Mexico, is somewhat of a unique response in that we were able to get some college dorms that weren't in use. It's from a college that went out of business about 6 months ago. And so our plan in Santa Fe is to get all the homeless people we can into those college dorm rooms. And they're not, well, I mean, like a college, some of them are set up more like apartments and some of them are more like dorm rooms. But and then from there get people into permanent housing. We already had plans to buy a residential hotel here in Santa Fe, and of course now the hotel owner is even more anxious to sell. He's come down quite a bit on the price, and so that would be the permanent spot for that. And so we're trying to use this emphasis on homelessness now to really end homelessness for people and not just make it temporary. I think the other thing that people haven't talked about, perhaps, we have a lot of people in New Mexico who camp out. And that is obviously that's increased because of what I said with our shelters closing or cutting back on their numbers as part of their decompression efforts. And so we're trying to set up better outreach. We haven't had great outreach, but we really need to reach out to people. When our state, all our businesses shut down and community centers, all the services that people who were living outside could rely on for places to take a shower or go to the bathroom, those are closed. And so this is becoming quite a problem around New Mexico. And not all of these people are going to be, able to move into the college dorms, although we'll try and get as many as we can. In terms of something else that's unique about New Mexico, I know we've all read about how African Americans are more affected by the virus. Well, in New Mexico, it's Native Americans. We have a very large percentage of our virus positive cases are Native Americans, and that's going to cause some issues. Native Americans are not usually as well, they are overrepresented in the homeless population, but they also tend to live in overcrowded situations to begin with, which is probably what's driving their being more vulnerable to the virus. So to address the overcrowding and the fact that we have so many homeless people here, we really need also, in addition to rent assistance, to fully fund the National Housing Trust Fund so that we can buy buildings or build buildings. We do not have enough apartments in New Mexico for everybody who needs them. Theoretically, we have enough housing, but some of it is high-end housing that we're not going to be able to access for homeless people. And so we just need more affordable housing in general. Thank you.
Great. Thanks so much, Hank. Thanks for all your work and for sharing what's happening in New Mexico. Really appreciate it. We're going to turn now to, on every week, we talk about unique challenges facing particular populations. And for today, we wanted to focus on immigrants and special challenges facing immigrant families. So we have Jackie Vimo on, who's an economic justice policy analyst at the National Immigration Law Center. So Jackie, I'll turn to you.
Great, thanks so much for having us on and also for addressing immigration issues that have been excluded from a lot of the health and relief responses. So I probably don't have to explain to folks on this call that we can't protect the nation from the coronavirus and its economic impact if we deny health care and financial relief and housing to large segments of our communities. And one of the things we've been saying a lot is that the virus and its economic effects don't discriminate based on immigration status. COVID-19 doesn't care whether you're a green card holder or citizen, but unfortunately our relief efforts have. And so I want to start noting that immigrants are disproportionately frontline workers that have been leading the response to the pandemic. And that's everywhere from being nurses and doctors and in agriculture, food preparation and delivery, cleaning and maintenance. And that if immigrants are not provided financial supports that are available to other residents, they're going to have no choice but to work to survive, and thereby putting themselves and everyone else at risk. And I think there's been some good news coverage about the fact that there are jobs that can't be done remotely on a Zoom call like this. I think we all know that you cannot pick crops remotely, and immigrants are largely ones doing that. So I think it's just important sort of to note that from a public health perspective that all community members have to be provided access to these programs if anyone if all of us want to be healthy. So I wanted to highlight basically the CARES Act, and really note that it's both illogical and immoral that the recently passed COVID-19 Relief Act, the CARES Act, excludes millions of immigrant family members, and that includes U.S. citizens, children, green card holders, who have made a home here with their immigrant family members. So, what we're hearing on the ground is that currently immigrants are reporting that they're terrified to get health care they need as they face the coronavirus pandemic. Obviously, images and the news that we've seen of ICE agents conducting immigration raids in masks has heightened fears that accessing needed care is going to lead to their families being torn apart. And, ICE has stated that they're not conducting immigration raids at hospitals and clinics, but, you're going to need more than their word, for communities to be assured that they can access care safely. But I think the other thing is that even if they didn't fear going to medical centers, that the CARES Act didn't ensure free testing and care to everyone, and families are now being forced to choose between, do I go to the health center and maybe go into tens of thousands or hundreds of thousands of dollars of debt, or do I, stay home and potentially not get the care I need? I think the other piece is that, immigrants are also afraid to access healthcare, housing, and other economic supports because of the threat of the new public charge rule that was just implemented last February, right as the coronavirus pandemic was ramping up. So under this new public charge rule, immigrants are scared that if they access programs like Section 8 or housing assistance or Medicaid or SNAP, food stamps, that they may jeopardize a green card for one of their family members in the future. Although many are not impacted, that's the word on the street. And U.S. Customs and Immigration Enforcement has promised that accessing COVID care and services won't be counted for public charge tests. But other programs, such as housing, that families may be newly eligible for because of the economic crisis, are not necessarily included in that. So, again, no one should really have to choose between a family's health or homelessness and staying together as a family, but that's exactly what is happening. And, again, this pandemic is showing us exactly why this public charge rule makes no sense and should be rescinded. And, similarly, we're waiting on the final rule of the mixed status families in public housing rule that's going to force families that are currently in public housing to choose between living with their families or sleeping on the streets or kicking their family members out onto the streets in the middle of a pandemic. And we're really hoping that we can put a pause on implementing this rule during this moment. So, finally, again, the CARES Act also excludes millions of immigrant households and taxpayers and their family members, either people who pay taxes like anyone else, from accessing the economic impact payments in the CARES Act. That means that, U.S. citizen children, spouses who are married to people who don't have Social Security numbers, they're going to get excluded from these economic impact payments just because of who they love. And, again, economic relief payments are crucial to help people from experiencing homelessness, from going to work sick, and really allowing our nation to heal. So I'll just close by saying that we have a new opportunity with upcoming bills that are being discussed to remove these immigrant exclusions. And that for the sake of the nation's health and for basic decency, we hope that they'll take action by suspending harmful rules like public charge and the mixed status housing rule, and pass a relief bill that doesn't discriminate based on immigration status, because all of us are healthier when none of us is left out of relief. So I will end with that.
Thanks so much, Jackie. That was a really helpful overview. We did have a couple questions come in while you were talking that you already answered, so that was efficient. The questions were around public charge, and really appreciate the information you shared there. And certainly just to say on the call that for all of the policy recommendations that the National Income and Housing Coalition has been pushing and the Disaster Housing Recovery Coalition has been pushing, we have been making clear that we believe that all of the resources that are provided, emergency relief resources related to coronavirus, should be available regardless of immigration status. Because certainly, as you say, the virus is not discriminating on who's getting sick, and none of us can be healthy unless all of us have access to the resources that we need. So thanks so much for your leadership on this issue, and thanks for joining the call. I'm going to turn now to J.R. Fleming. He's with the Chicago Anti-Eviction Campaign, and he's been a longtime champion for low-income renters. And he is going to talk a bit about the both the opportunity and the obligation that local governments have with all of these new federal dollars flowing to communities to make sure that any jobs that are created with those dollars go first to low-income renters in those communities. So JR, I'll turn it over to you.
All right, can folks hear me?
Yes, I can hear you fine.
All right, thanks for having us on. I want to jump right into it. And this current crisis is an opportunity. Please forgive how that sounds, but that's just the gist of it. We as resident leaders and advocates have created our own opportunities in the past. One of them opportunities was a Section 3 job order contracting program that we did in Chicago, took to Charlottesville in Ohio. We've been working with leaders in all of them states, just named, in addition to the folks in New York. Over the last few weeks, we have been on calls discussing as leaders what we would like to see come out of the $12 billion that went to HUD, right? Because in HUD funding, there's a mandate under the 1968 Section 3 Act that residents and low-income businesses participate. With that, we want advocates, residents, and leaders nationally and elected officials to ensure that there's enforcement of the CARES Act and HUD's funds for Section 3 and resident-owned businesses that can provide solutions to this economic crisis that we all are facing. How we do that is ensure that there's resident leadership in Section 3 business and resident-owned business participation. There's an opportunity to release contracts right away, right now, immediately, given that the African-American community and a lot of these large urban cities have been directly impacted. There's an opportunity for sanitizing contracts, cleaning contracts, right? We're not going to beat this virus without sanitizing not just the common areas of these buildings and residents for seniors and public housing residents, but the inside of them. So there's an opportunity for housing authorities to increase Section 3 participation by hiring the residents in the community, the Section 3 businesses from the community, the Section 3 businesses in their city to provide these services. There also should be immediate coordination between HUD and housing authorities with resident leadership, right? Under the business aspect, Section 3 businesses do qualify for Small Business Association resources and many resources in the state. However, due to the closing of housing agencies, various departments that would traditionally help residents, we calling upon HUD and the Housing Authority to reach out to the service providers in public housing community to ensure that Section 3 businesses are getting access to resources throughout this crisis. I wanted to talk about housing too, specifically the various areas that HUD has been appropriated money from. And that area includes housing choice voucher, emergency solution grants, right? We want them under the emergency solution grant, and we ask the resident leaders and advocates to push your local elected officials and federal elected officials to use some of the emergency solution grant money to redevelop some of the closed public housing units, because we know there's a greater demand for housing. In terms of increasing Section 3 opportunity contracts, we want to make sure everybody is looking to ensure every area, the public housing area, housing choice voucher area, senior and elderly housing area, tribal areas are meeting the Section 3 requirement. And there's a link you can go to on HUD website, or you can email section3@hud.gov with any complaints or recommendations on how this should be done. We also want interagency communication between the Federal Housing Finance Authority and HUD, right? We made mistakes in the past with the American Recovery Reinvestment Act and doing that area, not making sure that Section 3 businesses participated under that federal funding. We have an opportunity under this current round of funding, which is $12 billion, to ensure that under the Emergency Solution Grant, Community Development Block Grant, Housing Choice Voucher Grant, and the Public Housing Grant, that Section 3 is being enforced. And the only way to enforce that is to ensure that resident leadership is at the table. Currently in Chicago, like I said, we got several pilot programs going on. We're in a unique situation because our leadership, both federally and locally, are working with the leadership on the ground. particularly because we are community buyers with Federal Housing Finance Authority, meaning we get all of the Fannie Mae and Freddie Mac inventory. And we want that inventory not to just be used for homeowners, but to be used to provide housing for those who need emergency housing, transitional housing, but also to continue and expand our programs around low-income housing, because we are a low-income housing provider. And so with that said, we're going to need help from our national partners, our elected officials, to ensure that, particularly under the Housing Choice Voucher Program budget, that they're utilizing the inventory from the FHFA, the National Community Stabilization Trust NSI program, inventory from Fannie Mae New Community First program can go towards housing choice vouchers. It can go to emergency solution grant to provide housing, emergency housing, transitional housing for those experiencing homelessness due to COVID-19. There's also a Fannie Mae program called Home Paths and a Freddie Mac program called Home Steps that the federal government have inventory. We want to make sure that the housing authorities has access to this inventory, community groups have access to this inventory, and the funding coming through HUD under the CARES Act to rehab these property that could be put to an end use of low-income housing. So there's a lot of opportunities with the current programs out there. There just needs to be interagency communication to connect the money to them programs in the housing. On the project-based rental, same thing. We're saying utilize this existing inventory from HUD and FHFA. But most importantly, we are asking that the agency who's providing these housing opportunities for the folks in need to hire on Section 3 contractors, right? All of this money that HUD is given, that $12 billion, have housing stipulations related to Section 3. So what we're saying is that equip the Section 3 businesses with the tools, funds, and resources so that the Section 3 covered recipients could make every effort to create employment, training, and contracting opportunity for Section 3 residents and Section 3 businesses. As always, we see money come in that never meets the people it's supposed to get to. Here's an opportunity to ensure that this happens. So again, $12 billion of HUD funding. Section 3 is mandated with the spending of these funds that resident-owned business participate, Section 3 businesses participate. We want to see coordination so that those businesses can be a part of the solution in their community. And right now, we calling for the immediate release of RFPs from housing agencies to ensure that our senior residents, common areas and inside their facilities are being cleaned, because we're not going to knock down the deaths among African Americans if we're just cleaning common areas.
JR, thank you so much. Really important information that you're sharing, really important urgency around ensuring that we're doing the things that you're sharing, making sure that these funds are going to Section 3 contractors, and that jobs that are being created are going to low-income residents, low-income people in the communities where the funds are being spent. So thank you, JR. Thanks so much for your leadership on this nationally, and thanks for being on the call today. So
thanks for having us.
Yeah, absolutely. I'm going to turn now to, so we can spend a little bit of time talking about updates on federal resources. In previous calls, we've talked about some of the big funding pots and how those dollars are going to be sent out to communities, when, what they can be used for. Today, we're going to talk a little bit about some updates on the waivers and the guidance that are coming out of federal agencies. And I'm going to turn to Ed Gramlich, who's my colleague at the National Low-Income Housing Coalition. He's going to talk about some of the HUD waivers and resources. Ed, please go ahead.
Thank you, Diane. Can you hear me?
I can hear you, Ed.
All right. I was having some trouble earlier on. So I'm only going to touch upon the top line items given the time of the day. A lot of the details are in last week's memo to members and partners, as well as in today's memo to members and partners. First, at the Office of Community Planning and Development, as you all probably know, on April 1st, CPD announced the CARES Act allocations to local jurisdictions and states for the CDBG, ESG, and HOPWA programs. As Greg mentioned earlier, for CDBG, a $2 billion first tranche out of a total of $5 billion is being distributed using the regular FY20 formula. For ESG, a $1 billion first tranche out of a $4 billion pot is being distributed using the regular FY20 formula. And for HOCWA, $53.7 million is being distributed using the regular FY20 formula, plus an additional $10 million in one-time only HOCWA awards are being distributed to grantees that are currently administering existing contracts for permanent supportive housing. Also, CPD posted regulatory waivers on April 1st. These waivers apply to the Continuum of Care program, ESG, and HOCWA programs. And as I understand it, CPD is working on guidance regarding the CARES Act CDBG appropriations, although that guidance has not been distributed just yet. Switching now to the Office of Multifamily Housing Programs, Multifamily posted a third update on April 2 of its coronavirus questions and answers for multifamily housing stakeholders. And instead of holding real-time calls explaining key policy adjustments, as multifamily has done twice to the various stakeholders, multifamily switched to providing a recording. A new recording was sent on Tuesday, April 7th, to a list of so-called multifamily stakeholders. If you would like to get on that list to receive these recordings and to submit your questions and suggestions and comments, send an email to mfcommunications@hud.gov. That's MF is in multifamily, mfcommunications@hud.gov. Going over now to the Office of Public and Indian Housing, PIH updated its coronavirus FAQs on March 31st. There are quite a number of them. On this Friday, past Friday, April 10, PIH posted a wide-ranging number of waivers. PHAs can choose to use all, some, or none of these waivers without getting HUD approval. A summary of the key waivers is in today's memo to members, and we'll follow up with some analysis in the coming weeks. In addition, PIH intends to issue more guidance in the form of several notices kind of trickling out. They hope to have these all out by May 1st. Questions can be submitted and suggestions can be submitted at PIH-COVID@HUD.gov. That's PIH-COVID@HUD.gov. Also, PIH announced that $200 million in Indian block grants are being distributed to American Indian tribes and to tribally designated housing entities to help them respond to COVID-19. Now, in general, I recommend that you do not go to HUD's coronavirus webpage for updates because it is often not updated in a timely manner. Instead, I suggest that you go to each program office's homepage to get the most up-to-date information. So that would be multifamily, PIH, and CPD. I also suggest that you read memo to members and partners each week because we're going to be highlighting important updates as they become available. And then finally, on April 3rd, NLIC updated its list of congressional actions that we think are needed. In addition, NLIC is frequently updating a list of regulatory and policy recommendations to HUD and to USDA. You can find these on NLIC's COVID-19 webpage. Go to the column on the right and click on NLIC recommendations for the congressional asks and click on regulatory actions for the latest regulatory suggestions that we are offering. And that's my report, Diane.
Terrific, Ed. You covered a lot of ground in a short amount of time. I appreciate it. Thank you. And just want to underscore Ed's recommendation to everybody that if you're not receiving our weekly newsletter memo to members and partners, please go to our website and sign up to get it. It comes out every Monday. And as Ed said, you know, he's really digging into all of these waivers and guidance that's coming out of federal agencies. He's writing up full overviews of what's in them, and you can read that every week in memo. So thank you, Ed. I'm going to turn now to another one of my colleagues, Noah Patton, to talk briefly about some new resources that we have available for everybody about how we can work with FEMA to address issues related to people experiencing homelessness. Noah, please go ahead.
Hey, Diane. Can everybody hear me?
Yeah, we can hear you.
Cool. So yeah, I'll be going over just a little bit on DHRC's relationship with FEMA in the past, as well as the barriers currently in place to accessing FEMA funding. Hopefully that'll answer some of the questions we've gotten in the Q&A section. And then I'll go through current materials that we have on accessing and accessing FEMA funding and dealing with FEMA, the agency. So first off, just in areas of disaster across the country, those with the least ability to recover from a disaster not only are the hardest hit by a disaster, but also receive the least assistance. There's a myriad of reasons for that, but FEMA certainly is a large reason for that effect. So FEMA often resists calls to implement common sense reforms to lower barriers of aid for low-income people. The agency has a culture of strict adherence to narrowly defined protocols that kind of makes it difficult for the agency to be flexible and nimble in new situations, just like the COVID-19 pandemic that we currently find ourselves in. Currently, FEMA is in a bit of a bind. Just to give a little bit of background very quickly, up until a few weeks ago, FEMA wasn't even the lead agency in charge of COVID-19 response. So now they are currently attempting to stand up their systems for dealing with this in the middle of an ongoing pandemic, which is getting a little difficult for them. So FEMA has, just to talk about some of the funding available, FEMA has placed public assistance funding, which is assistance going to public entities or specific nonprofits, available for use to combat COVID-19. Public assistance is available nationwide thanks to the declaration of emergency issued by the president last month. States, territories, and tribes with major disaster declarations, which is the majority of the country at this point, can also access some additional assistance avenues, but none apply to housing, so I won't talk about them right now. For public assistance funding, specifically Category B, which is emergency protective measures, are open to address some housing needs in areas hit by COVID-19. Typically, the program does not cover non-congregate sheltering after a disaster. FEMA has other programs for hotel assistance that have their own myriad of issues with low-income individuals, but let's not get into that right now. However, so due to the pandemic, FEMA has included a slightly broader definition of the category that includes non-congregate sheltering under Category B. While FEMA would view that change as a significant widening of access to these resources for individuals experiencing homelessness, we would call that in housing still exceptionally narrow. Currently, the only people able to access this non-congregate sheltering, to access reimbursement for non-congregate sheltering costs, are individuals that have been exposed or tested positive for COVID-19, that do not require hospitalization but need isolation, and people who have, and high-risk individuals that need social distancing as a precautionary measure. So those are the three types of people where if an organization covers their non-congregate shelter, they can get a 75% match reimbursement from FEMA. So these all require a public health official to certify the individual is either high risk, has been exposed or tested positive to COVID-19 and need isolation. So that's where that is. So the goal of the FEMA public assistance is not to decongregate shelters. It is to get those high risk individuals out of the shelter system and into isolation. Just a quick note before I wrap up, just for the homeless services providers, I would, instead of seeking to apply for these Category B funds directly, I would really, emphasize that people should be in contact with your local governments and your state governments and their emergency management staff, so that their requests for public assistance can include the resources you need to move folks into non-congregate sheltering. And just one final note, as for individual assistance, which is FEMA programs that provide funding directly to an individual, they you know, I wouldn't hold my breath for that being activated for various reasons. So I think we're going to have to make do with public assistance for the time being in terms of getting folks into non-congregate sheltering. Thanks so much, Diane.
Great, thanks, Noah. And just to underscore for everybody, two things there. One is that FEMA is supporting some efforts to get very specific populations of people who are homeless into hotels. And so states should continue pushing FEMA to support those efforts. FEMA could be doing much more, and we will be starting to publicly really push them to do more and expand their definition of who they can reimburse for what, because they have broad authority, although very narrow interpretations of their own authority. And three, that was a lot of information for most people who have not worked with FEMA at all before. So Noah and Sarah at NLHC have put together a toolkit on working with FEMA in the COVID-19 pandemic. And we'll be sharing that out as follow-up to today's call, and we'll be circulating that widely. It's going to have a lot of the information that Noah just shared and some additional information that I think will be helpful for all of you who are just getting familiar with FEMA and the terms and what can and can't be used. So Noah, thanks very much.
Yes,
I'm going to turn now briefly to Sarah, also our colleague at the National Low Income Housing Coalition, to talk about any updates on federal policy advocacy for our asks of Congress. Sarah, please go ahead. Sarah, are you there? Okay, so Sarah, are you there?
I should be there. Can you hear me?
Yes, I can hear you now, Sarah. Go ahead.
Okay, sorry about that.
No problem.
So last week, after the White House requested another $250 billion in small business loans, Senate Republicans tried to bring that bill to the floor, trying to get unanimous consent among all lawmakers. Democrats blocked that effort because they wanted to be able to pair those small business resources with other resources, including hazard pay for frontline workers, new funds for hospitals, and more state and local dollars, as well as increasing the maximum benefits under the SNAP food assistance program. Right now, this bill is very limited in scope. It does not include any housing or homelessness resources. So we are continuing to ask advocates to call their members of Congress. As you all know, and what is made clear on this phone call, the health and housing needs of people experiencing homelessness are urgent and dire. They cannot wait for the next package. And renters are already facing enormous challenges paying their rent. In fact, the National Multifamily Housing Council reports that 31% of renters didn't pay their April rent on time. And we're likely to see that get worse and worse as people continue to face job layoffs and reduced hours. Democrats in the White House are talking about another big, robust coronavirus package that could, in fact, include housing resources or infrastructure dollars, but it's really not clear that this will actually happen, which is why we're pushing for housing and homelessness resources to be included in this smaller package that's being negotiated right now. Republicans are already voicing some hesitation about passing another massive spending bill. And by the time Congress comes back to DC to negotiate that bill, momentum may pass. And so we're not willing to take anything for granted. We want to make sure we're making the case that housing and homelessness resources are included in this package that's before Congress right now, and not some future one that may or may not happen. So if you could continue to reach out to your members of Congress, continue to talk to them about the urgent housing and homelessness needs you have in your community, and make the case for why these resources need to be included now and not later. Thanks, Diane.
Great, thanks, Sarah. And I would just underscore too to say what a big lift we have ahead of us to get the $100 billion that we know we need for rental assistance. You know, we were successful, we collectively, after a big effort to push for the $12 billion out of the CARES Act, getting $100 billion in a next package for rental assistance, in addition to the other resources and policy changes we need, is going to take an even bigger effort. So get ready and get your networks ready, because we'll really need everybody to be activating when the time comes to really make a big push for these resources. So I want to just share a couple more updates before we end the call, and that is that one, there's so much to talk about on these national calls, and we do our best to cover a lot of the issues, but just the magnitude of this crisis and its geographic scope means that we can't cover everything. So one, do check our website, go to the COVID-19 page. It's updated regularly. We're starting to produce FAQs with a lot of the questions that come from these webinars and beyond that we're not able to answer on the call. We're putting together these FAQs on different topic areas to get your questions answered. So check for those. We're also putting together toolkits. As I mentioned, we have a new toolkit that we'll be sharing on working with FEMA. And other fact sheets and new research and other resources. So check the website, and some of your questions and some of your information needs may already be there. And if they're not, we're continuing to churn out new resources and materials daily. We're also going to be doing more calls. So we're going to keep this national weekly call that has sort of the high level view of what's happening and what you need to know and what we need to know. But we're also going to do some additional smaller, relatively smaller calls to start digging into some of these issues a little bit more and have a little bit more time for conversation and more in-depth exploration of specific topics. So as you all know, we've talked about it every week. We already have a standing legislative call. Those calls are on Tuesdays at 12:30, and Sarah facilitates those calls. Those calls are about what are the opportunities right now on Capitol Hill to push our recommendations forward, and how are we going to get it done? So very specific, related to Capitol Hill strategy, working with legislators to implement and pass our recommendations. We're going to create, we also have a call that will likely be bi-weekly that's specifically for low-income renters. We had our first call last week. We'll have another next week, and we'll do those every 2 weeks for the foreseeable future, to talk directly with low-income renters, people experiencing homelessness, people who are struggling, to hear directly from you about what you're facing and to share information that might be helpful for you. We're going to start adding other weekly calls, likely have one related to implementation of federal resources. How is it working at the state and local level? What can we do better? What more do we need in terms of coordination at the local level? And what more do we need from the federal government to make it work? And we will probably do a weekly call on state and local resources, from eviction moratoria to rental assistance. You know, what's happening at the state and local level, what resources are being created, and what are we learning about what's working and what's not, and how can we apply that to other states. So look for more information on how to get involved in those topic area calls. If you have ideas for other topics, let us know. Really interested in figuring out how to get all of our arms around all of this as effectively and efficiently as possible. And I also wanted to share that many of you have raised, we've been looking into the question of how do renters know if they're covered by these various eviction moratoria. So there's a number of tools that are coming out over the next week, all of which I think are going to be helpful to groups. We've been talking with FHFA and others about how to get the data into a searchable database so that renters can know whether their property is covered for an eviction moratoria. So we're not there yet. Welcome ideas on how best to do that, and we'll keep at it, and we'll let you know when we have that information available. And so that's it for today. Thank you all again. Thank you so much for all of the work that you're doing in your communities. Thanks very much to our speakers for sharing their perspectives. And thank you all for joining. We'll be back in touch soon. Take care. Bye-bye.